And are junior doctors out of order to strike now? Thousands of junior doctors have walked out again for a 6-day strike. It is the longest strike in NHS history. This will postpone operations and appointments, which patients have already been waiting a long time for. Patients are being told to ring 999 if there is an emergency, but Charity Aid UK says that the strikes will deter elderly people from seeking care when they need it. NHS leaders say that it is their toughest challenge yet. So is this really the right time for junior doctors to be striking? You can get your calls in now, 0207 862 2222. Kulveer, what do you think?
No, look, it's definitely not a happy new year for patients. And also for all the other staff, the colleagues, the senior consultants who are filling in for this longest strike in NHS history. So it's absolutely not the right thing to be doing. I'm not on, I have heard the junior doctors' argument, but to be honest, I don't feel it holds water. This consideration of a 35% increase, when there is about, I think now, an 11% increase on the table that has been done through discussions. They want pay repatriation, which they're talking about from way back in 2008 to now. They feel that there's been an erosion in their pay. Maybe there has. But there are economic times through that period, 2008 to 2024. That's a long period. There are things that happened. There were 3 different governments through that period. I mean, a Labour government, a coalition government, a Conservative government. This is a strange argument for a militant junior doctor leadership, and I don't think all junior doctors are involved in this, to be putting this argument together. I don't think anyone in the public sector would be saying they would like to have a 35% pay increase. I think they've got to consider their position, look at the damage they're doing to their institution, to the impact on patients, the impact on their colleagues, and really get to a point where they have a sensible negotiating point.
I mean, some people would argue that junior doctors shouldn't be allowed to strike. Rebecca, what would you say to that? I
think everyone has to have the right to strike. I think it's...
Even the army?
Yeah, absolutely. Literally everybody. I mean, I don't think we need an army, but we can come back to that another day.
OK.
I fundamentally believe the right to strike is a human right, and it should be an inalienable right. And strikes have to be inconvenient and they have to cause pain. And I don't take any joy in that at all. I feel for anybody who's had an operation
But at their most extreme, this could cause death, I suppose.
But doesn't that tell you how important these people are? And if they are so important that they're not working, brings our country to its knees, shouldn't they deserve to be paid more?
35% though. There's nobody else that has got a pay rise quite that extreme.
I mean, I'm not sure anybody else is more important. I would say in this country the most important thing is our healthcare system, but also it is 35%, and that does sound chunky, I will admit. But when you look at how few pay rises they've had, how cost of living has changed, and how important they are, I think it actually does stack up. And also, it's economically not sensible to pay them so poorly that you end up subsidising their training, and then as soon as they finish training, they leave to go to countries where doctors are paid better. At the moment, we're losing people to New Zealand, to America, to all sorts of other countries, or they're leaving practising medicine to go and work in pharma tech.
Well, this is true, Kulveer. Now, how are you going to combat that if you don't give them a pay rise or become competitive?
These are interesting arguments that junior doctors and their militant leadership are putting forward. If you look at data from the BBC, so they're saying there hasn't been that much of an increase in the last decade of doctors leaving this country to go to other countries. That hasn't been happening. There may be a coming trend, but that hasn't been happening. Plus,
well, we have a shortage of doctors, so how are we going to encourage more people into the industry?
Yeah, and we've got to look at what can be done to encourage people, but there hasn't been that trend that they're proposing.
What can be done also, paying them properly?
But also, in terms of those other countries, and they potentially have higher salaries there, the cost of living there is much higher. In Australia, we know the actual prices to stay there, the cost for everything is significantly higher. So this argument that people...
wage is higher. I mean, yes, it's a different country.
So there's a challenge there about whether they're leaving. They're not. There hasn't been a change in the last decade about the numbers that are leaving. It's been constant. So, that's not an increase due to the pay.
OK, but we don't have as many GPs, for example. We don't have as many doctors and people in the NHS as we need. And so how are you going to encourage people into that industry if you're not going to give them an increase in pay?
Well, I think we do have to look at how the NHS works. Now, there's a fundamental issue around the NHS full stop. I personally don't believe it's fit for purpose, OK? I don't believe. The structure, every government is asked for more money to put into the NHS and gives it. And still we have these problems. We have a workforce problem, we have problems with the trust, we have problems with the service outcomes.
So what would you do, privatise it?
Well, no, that's not exactly the answer. There is a need for more technology. better usage of the kind of services that are provided, looking at the administration, looking at the types of ways servicing is structured in the NHS. Can everything do everything? Can every trust do absolutely everything? Now, there is a massive... Obviously, the NHS is a sacred cow. As soon as you start looking at it, people will say, you don't care about the service. I absolutely care. Everybody in this country cares about the NHS, but we want to make it work for both the patients and the people who work in it. I just don't think this unprecedented request from junior doctors for 35% is not the way to go about improving the NHS.
OK, well, we'd love to hear your experiences on this. 0207 862 2222. I cut you off there, Rebecca, sorry, and then we'll get to the calls.
You say we need better technology, but the only way that you improve the NHS is by letting the doctors run it and listening to the doctors. What we're doing at the moment is bringing in sort of CEOs of trusts who come from big business, who haven't worked in the NHS, who don't understand how the NHS works. We need to be listening to the doctors, paying them properly and understanding they know how to run the system better. And if we don't listen to them and we don't pay them properly, it will not improve. OK,
let's go to the calls. Helen from Dorset, have you been affected by these strikes?
No, I haven't been affected by them.
But that's great news. So what do you think? Is now the right time for them to strike?
No. I think it's an absolute disgrace. And that woman on your panel...
Rebecca, let's use names.
Yeah. Hi. She needs to learn that. She wants to think about the people who do pay them and what they've paid in for years.
OK, yeah. Helen, so can I ask... Do you think that they should ever be allowed to strike?
No, I don't think they should. I think they're trained by us and paid by us. And I think they shouldn't be allowed to strike. They think about nobody but themselves.
Ooh, doctors aren't famously a selfish profession, Helen. Broadly speaking, I'm not sure the first thing you accuse somebody who goes into medicine of being is selfish. If you were selfish, why would you become a doctor? To help people?
Yeah, exactly. Why have they become doctors?
To help people, but I think probably to also want to be able to have a decent standard of living, perhaps buy a house.
Oh dear, well, they're poor people, aren't they? Who doesn't want to rise in this country? How many young people can't afford their house?
Yes, Helen, but if you've gone to school, to university and sacrificed for however many years and gone into a profession where you're now working 12-hour shifts, you're having to cover people that aren't coming in because there aren't enough people covering the positions that there need to be. Would you not start to get a little bit peeved? You haven't had a pay rise for whatever it is, 10 years.
I don't know whether they have. I don't know whether they do earn.
We can tell you that they do earn. They earn between about £30,000 and £60,000, which actually, arguably, is quite a lot of money when you think about it in just those financial terms.
If you think
there's a lot of people that give their right arm for.
Yeah, but a lot of people didn't do the training, Helen, and a lot of people aren't going to save your life when you're ill. So when you need an operation or you go into A&E and you need that emergency care, do you want a doctor that's had a good night's sleep, that's fit for purpose, that's feeling great about being there, or do you want somebody that's knackered, can't pay their bills, and is struggling generally in life?
I think you get that anyway now.
But you get that because they're not paid properly. And the people who leave school to go to university to become doctors have the top grades in the country. So they could also go and join a management consultancy. And their starting salary would be around £100,000. Why would you choose a hard job like being a doctor when you could go and take an easier job with way more money?
I have to interject here because I agree with Helen in terms of, that doctors have the choice to do this. And actually, you said management consultancy. You can work in a management consultancy. I worked in a management consultancy. You work 16, 17, 18 hours a day.
So and like you started...
No, not a starting point.
At a top one now.
At a top, when you get there. But same with doctors. They can start on a salary. Eventually, having done their examinations, there's a career path to a much better salary as well. I think we need to be honest with people about what people will earn.
Out of Oxbridge, you can be making
£100,000 and you can become a top medical professional and at a certain point after... Not at 23, but I think there is...
At 45, you might, not at 23, but there is at 30.
But there is a certain commitment that doctors make. That's true. They make a commitment to people to do that. They don't want to go the other way. So then to be saying that they want a 35% increase, I think that isn't right. And the point here
what's more important,
is about this increase...
consultancy or being a doctor, realistically?
Well, it's like saying what's more important, having firemen or police people?
So you think that they're comparable in terms of importance? Going around and saying you should move your paperweights or saving lives?
I do think that's quite derogatory to people who do management consultancy and do do provide input into industry and business.
I feel okay about being derogative.
No, well, you can make that cheap jibe at it, but actually people do. The reason that industry makes a lot of effort is because it improves businesses. It does improve society.
Okay,
we can read about all kinds of workers.
We're digressing and comparing and contrasting other occupations, but Rebecca's making a point that actually doctors could go into other professions where they're paid more, and actually if we don't give them this pay rise, the argument is that they will do that in future and we'll be left with no doctors, presumably. Helen, but thank you very much for your call. Robert from Aberdeen, you're up next. Do you agree with Helen? Do you think that they should stop whinging and just get back into the wards?
No.
OK, tell us why.
The pay has been eroded for the last 12 years since the Tories came in. You've got a ward sitting there. It gets £300 a day for sitting on his bum.
Well,
in the House of Lords.
Robert, you should call in for the next part because we will get to that, and trust me, Kulveer will definitely get questioned on that. But for now, we're talking about junior doctors, and some people, including our previous caller, would say that they do get paid a fair amount and more than the average.
Yeah, but how many exams and everything they go through to get that?
But isn't it a vocation?
Yeah.
Okay, so if it's a vocation, then wage is probably not really up there in the priorities.
They should pay them for a vocation. You've got MPs who get more money than what junior doctors do.
Yeah, but I mean, they're two different jobs. If we start comparing and contrasting different jobs, there's probably a lot of unfairness, really, in the economy.
To become an MP, you just need someone to vote for you. You've got no exams, no nothing. You've got no payout, nothing.
Well, look, as you say, Storm, if we want to compare jobs, we can go all along the line. But I think here we've got the case that junior doctors care. That's why they choose to go into medicine. They make a conscious decision to say they want to dedicate their life to improving the lives of others in that thing. That doesn't mean
that they don't want to have to be able to pay
can I just say,
their bills.
They do know the pathway through that profession. It's really hard. All the exams, the long studying timelines that there are, the long training, the time in hospitals. I've seen it. I went to UCL. I had a lot of friends who studied at UCH. I saw the work, the effort, the study that they had to put in those years. But they made that really conscious decision, and that's, really proud of those people who do it. Now, along the way, yes, the salaries will increase. Now, they're saying, and it's about this precise argument at the moment, why they're on strike right now, is they're saying they want to catch up on pay from 2008 to 2024. Nobody in the public sector is saying that. Nobody, because there are different economic times we've been through that, and agreements have been made through that on pay through that period. So this argument that says they want a 35% increase now, I think that's the point that we have to say that's unreasonable. I'm not against junior doctors. I'm not against the effort they put in, the time, the commitment and everything else. But we have to have a realistic ambition for where the pay needs to be right now.
It is not realistic to expect that you can just pay them with clapping and goodwill. And I blame that whole clapping thing from the pandemic for a lot of this. The idea that doctors are heroes and they're saints. They are not. They are people doing jobs and they expect to be paid for them because they are jobs. It is a career. And if you do not treat it as a career, people will stop choosing it as a career and you will end up with an even worse shortage of doctors than we currently have. Or you will end up with very, very substandard doctors. If you want the best people in this country becoming doctors, you need to be commensurate with other salaries.
Well, that's an argument for everything. If you want better politicians, we should be paying them more.
Doctors are the most important. Well, I personally think doctors and teachers are the most important thing.
Robert, thank you very much for your call. Ron from Milton Keynes, what do you think about the strikes? It's a hard time for the doctors to be going on strike. Just after Christmas is a very busy time for the NHS particularly.
Well,
go on, Ron, what's your view?
Oh, right. Well, I think they should take a 35% cut.
Oh, and why would that be, Ron?
Well, look at the situation. You can't get an appointment anywhere at any hospital.
Well, that's because there aren't enough of them.
My wife had an appointment come through, not for this year, for next year.
Yes, Ron, so the waiting lists are incredibly long.
I mean, these nurses and doctors, they're saying they love the job.
Yeah.
Well, if they love the job so much, why aren't they doing it?
I don't think they are saying they love it. Most of the accounts that we've got here are from people saying they're having panic attacks, they're exhausted, they're burnt out. One of the main reasons that people...
Well, I don't know why.
What do
I
you
really
do?
don't know why.
What do you do for work, can I ask? Can I ask what you do for work, Ron?
Pardon?
What do you do for work? What's your job, Ron?
I'm retired now.
What did you do before?
I was worked in a factory all my life doing engineering.
Okay.
Was it stressful?
And if we had had the pensions and the wages that these people had, we would have been laughing.
Yeah.
And if we had been offered 11% rise, we'd have been over the moon.
I mean, maybe that's
all we had was
better
we can't afford anything, and we was lucky if we got 1%, 2%.
So, Ron, just to balance this out, because I think we're sort of digressing, and a lot of people do just hear the wage and they think, I don't get paid that, and so it's a good wage. But you've got exams and things involved, and I think just to go back to the waiting lists, what the junior doctors would say is the reason there are such long waiting lists is because there isn't enough staff. The NHS is so stressed and stretched that they just can't get through the amount of patients that they have to get through. So if we paid them more, we would be able to get more doctors, we'd be able to get more nurses into the NHS, and therefore they'd be able to see more people more quickly, Ron. But I hear your concerns, and it's very frustrating when you've got a loved one that's on those waiting lists. I can only imagine. Thank you so much for your call. Pete from Nottinghamshire. A lot of people very frustrated with junior doctors at the moment.
Well, I don't know why, because they definitely need that 35% pay rise.
OK, it's a very high pay rise. Although there's arguably not enough doctors, there's quite a few of them, so it's going to be expensive.
If it's excessive the way their wages have been, in effect, cut over the last 10 years at least. I mean, about £14 an hour. You can go to Aldi and you find workers down there.
Yeah, you're not going to get the
about £14 an hour. Now, I know who I'd rather see if I had a heart attack. As nice as them people in Aldi are, I think I'd rather see a doctor.
Yes, I understand that, Pete. And the argument about working in, stacking shelves or working in a coffee shop are comparisons that are often made. But I suppose the argument against that is that you're not going to get the promotions that you're going to get if you're a junior doctor. As Kulveer says, you're likely to get paid vast amounts as you become more senior in your profession. That said, I know junior doctors can be in that position for decades, so it's not...
Years and years before they get to that.
Yeah.
They've studied before they went for years. Years and years.
Yeah, I mean, I suppose that's where your argument falls down, actually, Kulveer, when we're talking about, they could go and work for the business sector and get paid a huge amount more. Yes, they're going to get paid as senior doctors a huge amount more, but you're a junior doctor not for 2 years, not for 3 years. You can be a junior doctor for 15, 20 years.
But do we recall recently where the Chancellor had to make a change in pensions because doctors would max out their pension contributions by a certain point and were retiring early? And to get those doctors to come back, we had to increase the amount that they could actually put into their pensions. These are some of the benefits of going into medicine, the kind of lifestyle eventually that doctors can get.
Very long time.
I'm just saying there is a benefit there. And that was, by the way, that was about, I think they were reaching the age of around 50, by which point they were retiring on a maxed out pension. So there are different things at different points in different careers that are benefits and can be challenging at different points in the careers and can be benefits in different points in the careers. I think we have to look at it in the round. But at this point...
One of the major problems is that if you work at UCLH, which is in central London, you cannot afford to rent, let alone buy, anywhere in a sensible commute on the kind of salary these people are being paid. You especially couldn't afford to be a two-person household with children. You would be in poverty on a one-person income.
Rather than getting focused and bogged down on the wage, let's just very quickly, because I know we're running out of time, talk about the timing of these strikes. Now, just after Christmas, busiest time in the year for the NHS because more people have been doing mingling. You've went to see relatives. Maybe you've told an older relative they should go and get something checked out. Maybe you've caught a bug that's then led you to the A&E. Very, very busy time. Not a very kind time to strike, Rebecca.
When is the kind time?
Well, summer.
In August, they call it killing season because everybody's on holiday, and it's when the newest batch of junior doctors are out of medical school and working. In September, it's the biggest time of year for births. There's a bad reason every single month, but also if you believe in strikes, which I do, you have to understand that you have to strike in a mean way. There is no kind way to strike. We don't do a tube strike on a Sunday. We do a tube strike when everybody needs to get to work. If they don't do it hard, nobody listens.
But aren't they targeting the wrong people? They're targeting sick patients. They're not targeting politicians.
Unfortunately, I would also say I've been in hospital with a small child during strikes, and they will always find a way to help you. No, I really, really do believe that.
Emily from Essex, you're up next. What do you think about the timing of these strikes? They are particularly mean, but Rebecca says in order to be heard, strikes have to be a bit mean.
Yes, I do agree with Rebecca. I feel really, really sorry for the doctors. Not forget the pay thing, it's what it's all about, but these doctors have taken, some of them have taken their lives. They're not living on good food to be able to support themselves. They can't have the house. They're suffering from depression because they've worked so hard over the last couple of years, let alone all of their lives, to train for this. And people are still working. It's still efficient. My doctor's is absolutely brilliant. I've had no problems, and I'm there every time. And the hospital as well. So there are good doctors.
But Emily, as Kulveer says, to every occupation there are the drawbacks and benefits. And when it comes to doctors, maybe the drawback is you don't get paid very much for the first decade, but you get a great pension at the end of it.
For them, it's about saving people's lives and going in there with empathy.
Well, if it was about that, they wouldn't be on strike. It's about pay, Emily.
It is about pay because they're suffering from depression because they haven't got enough support. Even that could pay for counselling for them. That could pay for a decent, warm home for them because they're not having that and being able to go to work and look after the patients, which is what we need them to look after us, and they want to look after us. We need to look after them for them to be able to look after us.
It's an interesting point there, Emily. Unfortunately, we've come to the end of this part. I know we did extend it a little bit because we were getting loads of calls on that. So thank you. Thank you for all your calls on this.